Science Forum. So we are thrilled to be back here live tonight. I have the distinct honor to welcome Dr. Lael Yonker. Dr. Yonker is a pediatric pulmonary physician scientist committed to improving the care of children with pneumonia and respiratory diseases. Dr. Yonker is the director of the MGH Cystic Fibrosis Center and co-director of the MGH Cystic Fibrosis Therapeutic Development Center. Since the onset of the COVID-19 pandemic, she has led the Pediatric COVID-19 Biorepository at the Massachusetts General Hospital and has helped shape our understanding of how SARS-CoV-2 affects newborns, infants, children, and young adults. Her research focuses on inflammatory responses to airway infections, and she is investigating the impacts of the viral load and immune responses in children. Dr. Yonker is also the mother of 2 school-age children, and we are just delighted she could be with us tonight. So without further ado,
Great, thank you so much for having me. So what a pleasure to be in person. This is fantastic. And so thank you so much to Amy for the invitation and for everybody for coming to hear what I have to say. So I'm going to talk about children and the COVID-19 pandemic. Thank you for that introduction. Let's see, so next slide. I'll just start with who am I, a little background. So I am the third child out of 4. You can picture me in the lineup there. So, I'm from New Hampshire. I went to Phillips Academy for high school, and then I went to Bowdoin College in Maine, did my medical school at UMass in Worcester, and then I've done my training here at Mass General, my pediatric residency, and then pediatric pulmonary fellowship, and I've stayed on at Mass General. I joined as staff there in, I want to say, 2013. So I'm a New Englander, and I've been around and happy to still be in Boston and really love Mass General and what I've been able to, who I've worked with and what I've been able to do. Next picture. So before the pandemic, I was happily working as a CF Center director and thought I was really busy, but I had no idea. And so the Cystic Fibrosis Center is this really great, so cystic fibrosis is a genetic disease that affects the lungs and the whole body of individuals, and used to, well, I guess still is associated with a shorter life expectancy, and really the lungs are what are mainly involved. Now there's been some really great medicine, so there's been a lot of incredible advances in the field. But my research was focused on this infection and how it affects the lungs. And so I would collect samples from patients, I'd study them in the lab, and try to advance care. And so when COVID came, it's a respiratory virus. We had this sort of sample collection research setup going. So we literally just sort of took our cystic fibrosis research and pivoted and started, launching into studying how COVID affects kids. Because if you remember, back in the early days, and maybe next slide, in the dark days that nobody really wants to think about anymore, this was, the adults were getting sick and just, everybody was home. Kids were not engaging with other kids. They were, those of us who have kids really remember, probably sort of in a traumatic sort of memory way, how the kids were home, and it was really hard and really isolating. But people didn't think kids were affected. I just remember talking with my colleagues and thinking, there's no way that a global pandemic isn't affecting kids. And so we needed to learn what was happening to the kids. Were they getting infected? And if they were, how come they weren't getting so sick? And so we started really, it was just a sort of, I get to share the story about this COVID research all the time, but I don't get to give the background, sort of the behind the scenes. But it was really hard, and we hustled. I mean, nobody was leaving their home. I drove to work. I felt like it was dark all the time. I call it the dark days because I would get to work before the sun rose, and then I would stay there well past sunset. And the hospital was empty, you'd see, I was leaving one day, see ambulances lined up front, but the highway was empty any time of day. The hospital corridors were empty. So it was really very eerie. And I do remember, you know, we had very little people. Everybody was told to not come to work. And so it was me and, you know, the technician who was working with me. We were hustling, getting samples from patients who were also scared and didn't, you know, most people were actually quite eager to help and provide samples so we could learn. But it was really, really intense. And then we'd come to the lab and, you know, I'd then process the samples, and it was a lot. And so we were able to get a lot of really amazing volunteers. Actually, next slide. We were able to develop a team, and this is only a fraction of the people who've actually contributed to the COVID Biorepository, but we, there's some kids, actually it's from my kids' classes, they sent letters for like people in the lab to try to like boost morale. They're still up in the lab and they really remind us why we're doing what we do. But you know, I feel like there was this really positive energy that came out of this really intense, very scary time. And so that was sort of the lab. And then I'd go home and I was worried what, you know, I go to these COVID screening clinics and we don't know how to protect ourselves. We don't really know how it's all transmitted at this point. And so I was nervous about transmitting it to my family. So like we had a guest bedroom downstairs. I had my own bathroom for brushing my teeth. I would sleep down there. And it was very like, we had sort of we came up with, like we do all the time, like we're still doing, we sort of figured, we made up what we thought would be safe. And so we listened to the guidance and as it was coming out, but it was definitely a weird time, so weird. And so, but I'm intense. And also I remember walking through a hall and being like, this is so intense, this is so crazy. I don't think I'm gonna be able to work at Mass General when this is all done. And I feel like a lot of people had that, and that's why the work, you know, part of why the workforce has been changing. But I definitely felt that. I've reacclimated. I love what I'm doing. I'm not leaving Mass General, but I remember being like, oh, like this is great, but this is crazy. What am I doing? Carrying like nose swabs through the hospital, but it was intense. So from that, next slide, we collected nose swabs, blood, urine, stool, whatever we could get from patients to be able to study. And this was back in the summer, right after, you know, when before school started. We put together our findings, we analyzed the data, and we published. And it was really, it was actually sort of amazing. What we found was very novel and met a lot of resistance, but now we know this to be true today. We know that kids can get infected, but there was a lot of resistance early on, and this is also part of the story that I don't tell. We got a ton of publicity from our findings, which was great, but I've learned, and I knew this going into it, but when you get a lot of positive feedback, there's also the negative feedback, and so definitely, and it's sort of funny because like this is now sort of assumed. Like we know that kids can get infected. We know kids can transmit to other kids or family members, and so and we know they mount immune responses and everything. But this was really pretty new, and it was I think also lots of political underlyings and implications for what schools would have to do. So there was a lot at stake, I think, and that was probably why we got a lot of negative feedback, a lot of positive feedback. But, and again, this is the part that I don't tell people because it's so crazy, but somebody actually threw a rock at my window at my house, which is crazy. And people told me that I was ruining my career, and like my mentors, they really turned me, some, not all of them, some really like made it hard for me because they were like, you know, this is a sort of a fad, you need to like back on your research. So it was really, really an intense time, but I had really good mentors as well. And I leaned on my really good mentors and my support system, right? My friends, and so it's good that you have each other. And my mentor was like, this has happened. You're making some important research, and you need to focus on the research. Don't let that stuff, the noise, distract you. And I think that was really great advice. So I did that. And so today I'm going to highlight some of the things that we did learn. We've learned a ton. And so next slide please. One of the things that we learned was that yes, kids have virus, but they do clear it fairly quickly. I mean, what we saw is this is live virus here, so not just nasal swabs and like positive tests, but how long is the virus live in your nose? And you really need live virus to infect others. And we found that really by day 5, most of the virus was cleared in kids, and that, thank God, is good because it lines with the CDC guidance, where this CDC guidance came out after our study, like significantly after our study. But staying home at 5 days, I mean, I feel better about the schools with that guidance, because I think that, these are kids from newborns to teenagers. This is better. It's not necessarily as accurate for adults. I've heard the adult data they can carry a little bit longer. But for this one person out of 110 samples or something that we had, they'll be hopefully wearing a mask. So this is great. So we learned about the virus in kids. Next slide. We've learned a lot about this syndrome called Multisystem Inflammatory Syndrome in children, which is something that rarely, probably 1 in 1,000, 1 in 2,000 of kids who are infected with COVID will develop this syndrome. And it's an interesting syndrome. So about a month to 2 months after you've had COVID, all of a sudden the kids will get high fevers. They'll have GI pain, maybe some vomiting or diarrhea. They'll have rash, and they can get quite sick. They actually can have heart issues, and they often will end up in the hospital. And some of them even can end up on cardiac support. They get very sick. And so we collected samples from these patients too, and studied them with some really amazing researchers and collaborators. And we found that what's happening is the virus, and this happens in all of us, the virus starts in the nose and then it goes to the gut. And we know this because we track the wastewater in the news. You saw that big spike because it sort of goes and then it's cleared in the gut. And for some reason in these kids it lasts longer. We don't know why, but it lasts longer and it irritates the gut. And it causes the gut lining to loosen a little bit, and it causes a leaky gut. So the viral particles that are in the gut leak into the blood, and so we see these particles in the blood. And so that's really been, that was sort of a really important sort of advancement in our understanding of the disease. But even better is there are drugs out there that tighten that leaky junction in exactly the way that this is, causing this leaky gut. So it tightens the junctions. So what we've seen, we treated some kids with this, and we saw the viral particles clear from the blood more quickly because they're not leaking into the blood from the gut anymore. And then they feel better. Some of the symptoms resolve more quickly. And we've treated a few kids with this medicine and published our findings in a couple different ways. And now we have a clinical trial. So this is really pretty, a clinical trial comparing it to placebo, which is like a sugar pill. And so this has been a really great advance in our understanding of this serious. So most kids do fine with COVID, but sometimes they get serious disease. And of course I'm like, I see the worst things. So my poor kids, I always expect the worst. So I really, so it's nice to know that we're making advances in this. Next slide. So also another really important thing is how do kids respond to the COVID vaccines? Because this is really important. There's been lots of debate about this. Actually, lots of news, some news information, and people have a lot. I think there have been some. Actually, I might have it on the next slide. I'll get to it in a second. But we're trying to understand how kids respond to vaccines. It's a whole new way of vaccinating kids, a whole new technology, and so we know that adults have their vaccine, their immunity wanes, so we get boosters. Same thing with kids, teenagers. So this is in teenagers, they need boosters. We're studying younger kids, we're studying kids who are in the Moderna trial, how they respond, younger kids who are the 5 to 11-year-olds, we're planning to study even the younger kids. And then some rarely people will get this heart inflammation following vaccines, and we're learning about that, and so we have some information coming up. Next slide. And this is really important because the pediatric response to vaccines, we need to have solutions for these kids. You can see, here's the chart, the number of kids with COVID by week. You can see early on there's very few cases, and then little blips. I think this was last winter. This was last winter when we thought things were bad. This was when school started. This was Omicron. And so there have been, over 40,000 kids who've been hospitalized from COVID, and over 1,000 deaths, which is, kids are not supposed to die. So that's really way too many. And so vaccines are an important component. There's been a lot of press about it with younger kids. I don't know if anybody has kids under 4, but people are really looking forward to that vaccine for the younger kids. And then it's been stalled. Florida came out and made a controversial statement saying that kids shouldn't get vaccinated. That's their guidance, which is in direct conflict with the U.S. Surgeon General and the American Academy of Pediatrics and the CDC. So, the role that kids play in COVID and the pandemic is actually, I feel like, when you first asked me to come talk, it was, I think, sort of early on, and then I feel as though I've gone back and forth. Like, I said to you, I don't want people to, stone me because of what I'm talking about with kids, but then, people go back and forth. What's the right thing to do? We don't know, and we're learning. And so that's what I'm hoping that my research does, is it helps us inform us. I have no agenda, I have no expectations, I'm keeping an open mind, and we learn as we go, and I think that's all we can do right now. Next slide. We've also been studying how, we have a really great collaboration with the OB group who's studying COVID. And so we follow the babies of moms who've either had COVID or been vaccinated, and then we found that vaccinating moms protects babies, for a little while. It eventually wanes, but that's really pretty exciting too. And so when you vaccinate moms, the antibodies get transferred to the baby, and the babies, if they do get COVID, they do better than the moms didn't get vaccinated. So all exciting things. Yeah, next slide. And so, we've like I said, we've learned a ton. I think there's still a long way to go. I think that the vaccine strategy is important. I don't think that this is the one and only vaccine strategy that's going to be coming along. So we have to learn how kids respond to all of these different vaccines, and whatever comes, what's the best dose, what's the best frequency. Clearly there's a difference in how kids respond to this virus than adults, and so we have to really tailor our research and emphasize it as well. For me, another goal is to prevent serious outcomes. A mild cold is fine, but we don't want kids to develop any long-term complications. We don't want them to get sick. We don't want them to get hospitalized. And so we're looking for ways to, see who, recognize severe illness early, and then also develop these treatments, because, I wear my mask a lot, but I don't think it's the solution. And I think we have to really, I think that, unfortunately, COVID, hopefully it'll be a nice summer. I don't think COVID is gone forever. So I think we have to figure out some better ways to improve what we're doing. But that's what, my research, I just wanted to highlight a few of those points and give you some of the behind the scenes story and the drama. But I'm happy to answer any questions if anybody has any. Yeah.
The Rock.
Yeah.
Let's see it. No, so what would spur someone to do that? Why are they taking their anger out on a researcher?
I don't know. I have no idea. It was right. It was right in my office window. So it was like, and that's it was very bizarre. But I wasn't there. None of us were home at the time. Actually, we came and we saw the broken window. But so crazy. It was it was a time the paper had just come out, and actually it was sort of our the press release had come out and it was really all over, but I think it, you know, it was a highly charged, highly stressful time for people, and I don't know, I can't imagine. I know. Yes.
How did you juggle
Oh my
your
gosh.
family?
Oh my God.
and your
Oh my God. I don't know. How did any of us do it? I
Yeah.
mean, this is, I was saying earlier that this is, juggling work and family is hard to begin with. And then throw a pandemic and my kids were home all for their school last year. So first, my husband is amazing, and thank God. He was like ready to jump out the window for sure. But and my kids, their school last year. I think my son, who's 9, he really like learned a lot about Roblox and Minecraft and YouTube. You know, so. But it was not the best academic year for him. But I think he's okay. My daughter was very easy because she's an 11-year-old girl, and she was a rule follower, and she was easy. She like loved her school. She would go for walks with her friends. She was really in the sweet spot for being able to like make this adjustment. My son was harder, and so yeah, I think it was just having a very supportive partner, and I also had my mom and dad were in our bubble, I guess, and so they would help out from time to time too. So yeah, it was hard. We all know the kids. Yes.
I have one question concerning the personnel at the hospital.
Yes.
Did they easily accept vaccination? Because sometimes, you know, even hospital staff didn't want to get vaccinated. How did they respond?
So our our group is I think because we you know see all of the bad outcomes because we're looking for kids who are hospitalized, and we're thinking about it all the time. We're all very, you know, we were there the first day it was available to us to get vaccinated, and still I think there's a lot of, you know, we're more cautious of the group just because we're worst case scenario sort of people. The hospital in the whole, I mean, the Mass General did mandate a vaccine and did have to lay some people off because they didn't get vaccinated. And I feel like the flu, now it's interesting, now there was a precedent, you know, I had to get my flu shot too, or else I would, we all had to get our flu shot too, and I was so focused on COVID. All of a sudden I saw this email, it's like, I have to get my flu shot or else I'm gonna get fired tomorrow. So, you know, I just get it in the clinic, it's easy, but it like totally off the radar. And same thing with my kids, I'm like, I gotta get your flu shot. But anyways, yeah, there was, for the most part, the hospital has been very, you know, we also are around people all the time who are you know, immunocompromised or more vulnerable, so, the hospital is, you know, we have to wear masks all the time and very, much more slow on sort of, you know, opening up. And so I think there's more of an embracing of vaccination. Yeah.
Mine isn't really a question, but I was so happy to see your name in the published research because with these hard times that you've gone through, you're part of history, you know, and it's.
Yeah, thank you.
My heart breaks for you for some of the
Yeah.
trials and doubters.
Yeah, but you know, I you know, I think it's all worth it. I mean, and I'm pretty good about, like my personality is I'm pretty good about staying focused and like not like letting other things sort of brush off. But yeah, it's been really interesting, and I think that the advice that I got from my mentor is like stay focused and you know, do good science, and as long as you know you're doing good science and you trust the data that you're making, and you know, you just do the right thing, and it all works out, and you sort of don't get distracted. And I think that's really great, you know, really great life and like advice in general.
But also just like, you know, that drug for the leaky gut, it's like bing and bing and bing, and it's, you know, this teeny window that we're in, it's teaching us so much.
Yeah.
You know, in a compressed time frame.
Yeah.
It's really, really amazing.
Yeah. Thank you. Thank you. Yes.
So I'm curious, so much of the science has been like in the moment, and
Yeah.
ever changing. Tomorrow's going to be different. So I'm curious if now that you might see that you have some breathing space and can actually make some long-term,
Totally.
what that might look like.
Oh.
Like how are you going to like be doing things
You were
and
reading my
looking.
mind. You were reading my work schedule. No, I'm very happy that things are calming down, and because now I've got a plan for grants. Because being a science, being in science, you have to get funding to do the research, and so all of this I've been, it's like, oh, a vaccine's available. We've got to collect samples, and collecting blood on children, like a 5-year-old, is very hard, or a 13-year-old, very hard. You got to pay them money. So, so $50 gift cards to everybody who donates blood. And we like to collect blood at 3 or 4 time points. So it's been pricey, but it's, I've gotten a lot of support from the hospital. We've had some individuals who've donated for this research, and so it's been amazing. And then I've worked with great collaborators who see the importance and the time sensitivity of we need to know why, why the myocarditis, like we're working on that, we're doing all of this stuff, and that's sort of something that's in the works. People need to have this data, and so there's no time to get the funding. We sort of figure that out later, but now I'm in the figure it out later time. And so I've been writing a ton of papers, and Amy and I were sort of commiserating earlier. Now it's time to write the grants, and it's a little different, and I feel like I'm not as good at writing the grants as now I feel like I can write papers pretty well. I've been writing a ton because we've just been learning so much, but now that's my time to plan, to dig deeper, to have that 5-year plan, but that takes thought, and I need to make sure I'm disciplined at this point to be able to set that thought time aside. I'm so used to running around, collecting samples, setting up meetings, Zooms, so now you have to sort of focus. But yeah, I'm excited. It'll be the next phase. Hopefully things will stay quiet. Yeah. Oh, yes. Sorry.
So, thank you for your bravery
Thank
to,
you.
get out there and do the research, and certainly I understand the whole, Harvard culture of publish or perish. You really, this was work of the heart for you in the beginning, and do you think, the example that you've set as, research scientist doing work of the heart, certainly, you had people that didn't approve because you scared them.
Yeah.
But now, moving forward, clearly the hospital supported you. You have opportunities to apply for grants. Do you think you've changed the culture in general in research, in that here's an opportunity, people?
Yeah.
It's in your own backyard. Do you think that, you will have an opportunity to mentor other young scientists and say, work of the heart is expensive only if you don't do it?
Yeah. Yeah, no, it's been really great. I do think that things have changed because of this activity. I think that first, as far as mentorship, we do have a lot of young women who are applying for medical school, doing research coordinator sort of positions, and we've had some really great people come in. And the lab has really grown, and a lot are young women, not all, but a lot, which I really like. And I do find that I'm writing a lot of letters of recommendation, and but I like that. Yeah, exactly. I can see it a little bit. I do think that having this being visible and finding this sort of balance. I mean, Mass General has a really great research footprint, but pediatrics is much heavier clinical. So to have this bridge is a little bit new. There are amazing pediatric researchers. I'm not saying that there aren't. They're really great, but to have this real translational component, I don't think had been there to this extent. And so I feel like I have sort of paved this new way that, it's great. I have this, we'll go into the ICU, and the ICU doctors know when somebody comes in who they'll reach out to me, they'll email me, they'll text me. And so it's great back and forth with the clinical teams when, and a lot of the residents even have reached out to me and they're like, would love to be involved in research. So I feel like I'm showing people a little bit of research, which I think is important to think about. Not only how can you take care of the patient in front of you, but how can you take care of like many patients. And so I try to get people excited about it. I try to make it as easy as possible for them too, because I don't want to scare them away from the amount of work, because there is a lot. So I try to have like my team help and just sort of, usher people along. No, I can see that there's some ability to impact other women going into science, and so I do try to take advantage of that.
Thank you.
Yeah. There's a question right here. Yes.
Do you think that we'll ever know why some people were so much more affected than others, other than the comorbidities like Nick Cordero early on, healthy 42-year-old? I mean, do you think it'll come out to be like blood type or nationality, or how do you think?
I think we will know, but I don't, like, there's lots of things that are going through my head, but what caused that? We know that when the virus somehow gets into your blood, or these antigens, like the antigens, meaning viral particles, pieces of the virus, get into the blood, people get really sick. And so, and certainly the adults who were the sickest had more virus or particles in their blood. But why did they get that? I don't really know, because it's usually after the fact, it's not when they have that highest amount of virus in their nose, it's usually later. And so that's the question I don't really have the answer to, but there probably are some genetic predispositions, we've seen that, but I don't have a good answer for you yet. Yeah, who are the kids that are going to get Miss C? There is a genetic predisposition according to some of the data that we've seen, but it would be nice to know beforehand. It would be nice to prevent these severe outcomes. If you knew you were more likely to have a severe outcome, to have treatments like this, this treatment that I was talking about earlier, if your child was more vulnerable for some reason or saw early markers, then maybe you could take a preventative medicine and not get the outcome, rather than sort of playing catch up once they start to get sick. So that would be an ideal situation.
One more question.
Yeah.
I asked this because I have asthma and this was my strategy around it. Do you feel like people who know, and children too, who have things like that, taking Singular and drugs that kind of prevent inflammation up front, is that a beneficial strategy?
I do think that keeping your asthma under control is a good strategy, just because if you do get anything, you don't want to sort of tip things in the wrong direction. Or that's one benefit. If you did get the virus, you don't want to sort of set yourself off or set yourself up to doing worse. Also, you don't want to get colds during COVID, because no matter what, you have to, go get swabbed, and everything's very disruptive. So I do tell my patients to make sure they're on their medicines, just so they stay optimized and healthy. So.
Do you think that drug is beneficial though? I was really watching the research on that.
Yeah, the lorazepam. So it's being compared to placebo right now, so we'll find out. But we've enrolled 7 out of 20 patients. We're opening up at one other center now at Johns Hopkins, and then I'm hoping to open up at another center, because I think that we've had more than 20 patients come through, but it's hard it's a lot of work to enroll a family when their child's really sick in the ICU and there's a new medicine. I mean, it's very low risk. It doesn't get absorbed into the blood, so, but it can be hard, I think, to convince parents to participate in research. So we're trying to cast a wide net. Of course, we're not supposed to do this, but I'm like, I think that one's got it, I think he didn't. So I do, based on what we've seen in open label, I think that there's improvement in GI symptoms more quickly than people who don't get it. And then seems to be an improvement in the amount of virus in the blood, or particles in the blood. We'll see with the placebo. I think better is if this drug does work as expected, would be to start before you start to get sick. So that would be sort of a follow-up. Next study is a preventive. Yes.
So I'm curious, like you said, the vaccine's still new and we're still finally kind of coming out of panic mode, but as things progress and things get more stable, do you see the COVID vaccine trending more in the way of like the MMR vaccine where it's mandated for kids to go to school, or more like the flu vaccine where it's like highly recommended that you get this?
That is a good question. If I were to guess, it'll eventually be like a highly recommended vaccine. I can already see a little bit of the pushback. Now it's mandated, we're in a pandemic. I mean, it's hopefully this pandemic, hopefully we're starting to get out of it. I don't think it's gone, but hopefully we'll get there where it's just like the flu. I do expect it to be seasonal. I mean, that's what we've seen over these past couple of years. No, I don't think masks are going to be part of our lives forever. I think that, and I don't think that the vaccine mandate will necessarily be part of our lives forever. But who knows? It's so hard to predict. Yeah, you're welcome. Thank you so much.